Now, what happens with diuretics is that all of them act on a different segment of the nephron. So, if you look at this diagram, this is the nephron, and each of the diuretics will act on a different segment. There are a few which will act on PCT, or the proximal convoluted tubule, something on the loop of Henle, something on the distal convoluted tubule, and something on the collecting duct. So every diuretic will act on different segments, and I will discuss each diuretic group and the segment that it acts on in this video. So we have two groups of diuretics which will act on the proximal convoluted tubule, which are the osmotic diuretics and carbonic anhydrase inhibitors. These two groups will act on the proximal convoluted tubule. First group is osmotic diuretics. What they do is that they cause free water loss in the proximal convoluted tubule. So there will be free water loss, just water is removed, and so the fluid coming in the proximal convoluted tubule, it will retain the water, it will not be reabsorbed. So whatever fluid comes from the Bowman capsule into the PCT, it will not be reabsorbed, or the reabsorption will be less, and more of it will be retained in the proximal convoluted tubule to be eventually excreted. It also reduces sodium and chloride reabsorption. Since sodium chloride are absorbed along with water, the reabsorption will be decreased, and there will be increased excretion of sodium, chloride, potassium, magnesium, calcium, and bicarbonate. So all of these important ions that you have, they are increased, the excretion is increased. If you look at the major side effects, it can cause headache and electrolyte imbalances due to loss of all these important ions. And osmotic diuretics like mannitol are used in acute congestal glaucoma, cerebral edema, and dialysis disequilibrium syndrome. Next is carbonic anhydrase inhibitors. They will reduce sodium and bicarbonate reabsorption. So this will be reduced, and along with that, potassium excretion is also increased. This is the main action of carbonic anhydrase inhibitors, and they are used in glaucoma and acute mountain sickness. Glaucoma and mountain sickness are two very important uses, and the side effects are acidosis, reduced potassium or hypokalemia because of increased potassium excretion, and hypersensitivity reactions are also a very important side effect. If you look at the drugs acting on the loop of Henle, we have the loop diuretics, which are the most commonly used and the most high ceiling diuretics that we have available. So loop diuretics will act on the loop of Henle, and the channel that they inhibit are the sodium potassium 2-chloride channel. In the loop of Henle, we have this channel which is responsible for the reabsorption of all these ions. Loop diuretics will inhibit the reabsorption of all these ions by inhibiting this channel. So they will cause an increased potassium excretion also, and an increased bicarbonate excretion also. So sodium is excreted, chloride is excreted, potassium is excreted, bicarbonate is excreted. When all these anions are excreted in the urine, the water is also not reabsorbed along with them. So that will cause a net water loss also, and hence reduction of the blood pressure. In the side effects, we have hypokalemia because it increases potassium excretion. We have metabolic alkalosis. We also have reduced magnesium and reduced calcium. So hypomagnesemia and hypocalcemia is also caused due to loop diuretics. This is a very important side effect. Hypomagnesemia and hypocalcemia is also caused. Uric acid will be increased, but because of loop diuretics, blood pressure is obviously decreased, and it can cause dehydration because of loss of water and electrolytes. Another very important side effect of loop diuretics is ototoxicity, since this sodium chloride potassium channel is also present in the ear, and this is what is involved in the formation of endolymph. So it can cause ototoxicity and hearing disturbances. The uses are edema, most edemas of any kind, your cardiac edema, congestive heart failure, pulmonary edema, it is used in all of this, renal edema. Then hypertension is also another use of loop diuretics, and hypercalcemia of malignancy. The next group we have is thiazides, which will act on the distal convoluted tubule. Now, thiazides will act on the sodium chloride channel, which are present in the DCT, and they will inhibit this channel. So, when this channel is inhibited, sodium and chloride reabsorption is inhibited, which will lead to a reduced reabsorption of water also, and it will cause increased excretion of water. Now, what they will cause is increased sodium secretion or increased sodium excretion and increased potassium excretion. Potassium excretion is also increased. Thiazide diuretics are used in edema, they are used in hypertension, they are used in diabetes insipidus, and they are used in hypercalciuria. Hypercalciuria meaning there is an increased excretion of calcium in the urine. Side effects of thiazides will include hypokalemia, since we saw in the actions that it will cause an increased potassium excretion. They will cause dehydration, reduced blood pressure, dilutional hyponatremia, nausea, vomiting and diarrhea, and hyperuricemia, which means increased uric acid levels in the blood. Now, we have seen that loop diuretics will cause hypomagnesemia and hypocalcemia due to increased excretion of calcium. On the other hand, thiazides will cause hypomagnesemia just like loop diuretics, but they will also cause hypercalcemia. They will cause increased calcium levels in the blood. That is why they are used in hypercalciuria. When calcium is being excreted in the urine excessively, they will cause inhibition of that calcium excretion and increase the calcium reabsorption. Since one of the side effects of loop diuretics is a reduction in the calcium levels, it can be used in hypercalcemia, which is caused due to malignancy, to flush out the excess calcium present in the blood. Finally, there are two groups of drugs which act on the collecting duct. They are your ENaC inhibitors or epithelial sodium channel inhibitors, and you have aldosterone antagonists. ENaC inhibitors are epithelial sodium channel inhibitors. These channels are present in the cells of the collecting duct. These are potassium sparing, which means just the way thiazides and loop diuretics cause excretion of potassium, they will not cause excretion of potassium. They are potassium sparing. They only act on sodium. So they will increase sodium excretion and they will reduce hydrogen excretion. So hydrogen is also retained and sodium is excreted. In the side effects, we have nausea, muscle cramps, diarrhea, acidosis, and headache. These are the side effects. And the drug that is included in this group is amiloride and triamterene. And amiloride specifically is used in lithium-induced diabetes insipidus and also in Liddle syndrome. These two are the main uses of amiloride. Lithium-induced diabetes insipidus, that is diabetes insipidus which is caused due to lithium use, and Liddle syndrome. Side effects will include drowsiness, confusion, ataxia, hyperkalemia because of reduced potassium excretion, acidosis, and gynecomastia is a very important side effect, and erectile dysfunction in men. Gynecomastia in men and erectile dysfunction in men, and hyperkalemia. These are the major side effects that you have to remember. Rest, it is also good to remember them, but if you have to majorly remember something, remember gynecomastia, erectile dysfunction, and hyperkalemia. Spironolactone or other aldosterone antagonists are used in edema due to liver cirrhosis. If the edema is caused due to liver cirrhosis, then what we use is spironolactone and other aldosterone antagonists. Other than that, it is also used in resistant hypertension, in heart failure, and in Conn syndrome.